The Ozempic craze doesn't appear to be slowing down anytime soon, but these weight loss drugs raise serious questions about their safety, particularly for women who wish to conceive. Let's welcome back Dr. Jessica McLaughlin, reproductive endocrinologist at Coastal Fertility Specialists. Always great to have you with us.
Oh, thank you for having me.
And I'm glad that you're here to talk about this topic because we're hearing more and more, both men and women, using these types of weight loss drugs to drop the weight, keep the weight off, but I can only imagine it poses a complication when it comes to fertility. Is that true?
Yes, I think it's with new medications, we always have to be really careful. So I am, pre-conceptual counseling and optimizing health before pregnancy is so important. I really spend a lot of my time talking to patients about that and really kind of lowering a patient's BMI if they are in an obese range. We know obesity is, associated with kind of less successful reproductive outcomes and more complicated pregnancies. So some patients really need to kind of take some time to optimize health. But with these kind of new medications, we have to think, well, are they really safe for fertility and pregnancy? And so with these new medications, kind of early studies, say they're really not safe for pregnancy right now. And so if a patient is on these medications, we actually don't recommend they get pregnant during that time and are really off of it for 2 months before pregnancy.
I was going to ask, how long should they be off of it before they start going down that road of fertility treatment? So you say 2 months is enough to get it out of your system?
Yeah, right now the recommendation is for 2 months. There's just been concerning kind of early studies like within animal studies. And so with any new drug, the risk is unknown and we need to be really careful. And so what can sometimes happen is, for example, some women that don't ovulate, they lose a small percentage of, even a 5% weight loss. For some women, they'll start ovulating again. And we really don't actually want you getting pregnant, on these medicines. So using a form of contraception while you're on the medicine. So sometimes we're taking a discrete amount of time, say, I'm not, trying for pregnancy, I'm just working on weight loss right now, and then I'm gonna safely come off the medicine and kind of get into treatment.
But there is a risk though with those medicines that you have to stay on these medicines if you want to maintain the weight loss. As soon as you stop taking it, we hear in many cases, maybe not all cases, but in many cases, the weight does start to come back on. And of course, when you become pregnant, naturally you're going to be gaining weight. So what does that spell for someone who is already struggling with weight gain and obesity versus then going down the road of pregnancy and gaining weight that way?
Yeah, I think it's a little bit of an unknown. I think this potential kind of regaining time period, we don't really know what that looks like for a fertility kind of standpoint. Does that in and of itself have kind of negative effects kind of for pregnancy? So I think to be careful trying to kind of maintain healthy habits during the 2 months that you're off the medications, and then working closely with a doctor to kind of make sure we're being as healthy as we can during pregnancy.
What kind of long-term studies? I mean, the drugs haven't been out for that long, so we don't even know really 5 years, 10 years down the road what kind of an effect it's going to have just on your own system.
Right.
And I wanted to ask too, could it affect men's reproduction? I mean, does it lower sperm count? Does it cause other issues that would then you would see it manifested in a pregnancy?
I think you bring up a great point. We don't know long-term outcomes, so there are no long-term studies yet, so just being very kind of careful going forward. And I will tell you, I don't think this study has happened yet, but we know obesity can affect sperm, and so there could be on some level an effect of that, and I think kind of more to come.
Yeah, okay. And for typically a person who does have obesity and they want to conceive, what do you usually tell them? They haven't even taken the drugs, they just they diet and they do the things that they think they should be doing. What's your advice for them before that conception process?
Yeah, so I think it's a conversation about kind of getting help involved, and that's not only healthy diet and exercise. Sometimes that's mental health support, maybe that's nutritional support. But we're always also thinking about I'm also thinking about this, but I think about eggs a lot. So I'm always thinking about what does prolonged time also mean? Women are continuing to age and egg count's going down. So I think that's where kind of talking with a reproductive endocrinologist endocrinologist will help you kind of fine tune, do we just need to work on this first and delay pregnancy? Is it something we can all do together? So making a really good plan with a doctor, will be important in that scenario.
Yeah, and I guess to start the ball rolling as soon as possible and having that conversation with your doctor, because it's almost a race against time with every passing month, with every passing year. Like you said, the eggs start to diminish.
Yeah.
But of course, you want to be in a healthy space before you embark on that journey. So really, it just does start with nutrition and wellness, overall holistic wellness. Dr. McLaughlin, always a fount of information. Thank you so much for joining us.
Thank you.
We'll be back in 2 minutes.